Good afternoon. I have a great pleasure to have one of my good friends, patient friends, with me here today. A very, very special person. He is older than I am, which in my age is difficult to find. But he is 82, and he is as active as somebody can be. Jim, very much welcome. Thank you very much that you found time in order to talk to me.
Thank you, Peter, for inviting me.
Oh, okay, it's a pleasure. So, Jim, I mean, you're fighting since quite some years with MPN. Why don't you tell me from the beginning? How did you diagnose, or did you notice maybe before that you might have an illness? Tell me a little bit, about your MPN life.
Certainly. Okay, so let's. So we're in the year 2023 now.
Yeah.
I would say about 9 years ago, during a normal blood test at my annual physical with my doctor, there was something strange about my blood, and he sent me to a hematologist that he used all the time here in Manhattan. I went to the hematologist and he said, your platelets are a little high, but let's not worry about it now. The reason he said this, Peter, is because he was not a specialist in MPNs.
Yeah. So he was your house doctor, yeah?
He was your everyday run-of-the-mill hematologist oncologist. So I didn't think anything about it. Now let's go back about 6 years now, maybe. Let's see now, because of the pandemic, it's a little screwy. Okay, let's go back about 8 years. And again, the blood test happened again, and I went back to him, and this time he was more serious.
Yeah, you had high platelets, yeah.
And he thought that he did more blood tests, and he said, you have essential thrombocythemia with a mutation called JAK2, and I think I can help you. What he was doing is he was like, when I was a student playing the trumpet years ago, my first trumpet teacher stayed 1 week ahead of me by looking in the book. He didn't really know anything.
Yeah.
And it's basically the same thing with this hematologist oncologist. So he ended up by giving me too many pills. He had me on hydroxyurea, but at the same time, he gave me another drug which you don't see around too much anymore called anagrelide. You may know that one too.
I know. It's very typical for ET, for thrombocythemia. Yeah. Now, one question in between: did he make you a bone marrow extraction?
Not at that point.
No.
That's next.
Okay.
What he did was he was trying. The only real symptom I had that he could see was that my platelet count was very high.
Okay.
So what he did was he gave me hydroxyurea, and he gave me too many pills, and then he gave me anagrelide at the same time. I woke up one day. Now now let's fast forward to 2020, October 2020. I woke up one day and I had heart failure. I was rushed to the hospital. And the reason for the heart failure, from what I can read and from what I can understand, was the anagrelide.
Sure.
And there was just too many pills. He had no idea of what he was doing. At this point, I don't think he wanted to see me die. And, I'm here in Manhattan, and we have 5 or 6 hospitals where we have specialists that deal in these blood cancers. So he sent me to Mount Sinai to a marvelous woman named Dr. Marina Kremianskaya. She's an expert on MPNs. And what she did was put me on a small dose of hydroxyurea, and it worked. It brought my platelets down to a reasonable number.
Sure.
And
she stopped anagrelide, no?
Say that again? No more anagrelide. Never.
Yeah.
No more. No, forget it. So this was my first appointment with her was on November 1st, 2020, just about 3 years ago. And I've been seeing her every 2 weeks, every 3 weeks, every month. And everything was going very well until recently, where my platelets, my hemoglobin wasn't at a decent number. My hemoglobin with her for the last 3 years was about 11, which wasn't too bad. But in September of this year, I had 2 stents installed because I had two arteries that were blocked. And they installed 2 stents at Mount Sinai Hospital in September of this year, a few months ago. And from that point on...
How did you notice that they were blocked?
Echocardiogram. My cardiologist sent me to the hospital for an echocardiogram. They did tests. And they thought that there was a good possibility that I had blockage. So 2 stents were installed on September 5th. And from that point on, my hemoglobin has been around 8 or 9, too low.
Yeah.
Anemia. And of course, I don't feel great because of that. I don't feel horrible. I don't feel great. So recently, I think it was on September 15th, GlaxoSmithKline had a new drug that was approved by the Federal Drug Administration here in the United States. It's not approved anywhere else.
I know.
Momentolinib, or it's now called Ojara.
Right.
And I've been using Ojara now. I was approved, I was prescribed, and they sent me a supply of Ojara, and I've been taking Ojara for at least a week now. And Ojara does 2 things that other myelofibrosis drugs don't do. Number 1, it attacks anemia, which I have. And number 2, it keeps the platelets down. And that's my other problem. So hopefully Ojara will work for me, and it will help me.
Yeah.
I don't have a spleen. My spleen's not enlarged, so that's not a problem. I don't itch. I don't sweat. So that's basically what it is.
So tell me, you this anemia was very, very bad for you. You probably been very tired, and gives you a lot of problems.
Yeah, thank you, Peter. The 2 symptoms that I live with are, again, I'm very tired. And what this means is out of a 24-hour day, I probably sleep 14 hours a day. I have 5 hours in the morning and probably 4 or 5 hours in the evening that I'm awake. And in between, I take a big nap. After I say goodbye to you, I'll be taking my nap. And then in the early evening, I still practice the trumpet every day. I'm a trumpet player, as you know.
I know.
And I don't miss my trumpet practice. That's usually between 5 and 7 p.m. just before dinner. And then after dinner, I go to sleep. So I'm tired. And the other symptom is shortness of breath. It's not easy going up a flight of stairs. I didn't have that problem, ever in my life.
But this might be because of your heart problem, no?
It could be very much. Well, I think the heart problem and the myelofibrosis are working together to make it difficult for me to walk up the stairs.
Yeah.
Also, if I walk more than 2 or 3 blocks, I'm very tired.
But do you think that the myelofibrosis caused your heart problem? Because you said before you didn't have that problem, no?
I don't think the myelofibrosis did it. I think that the anagrelide did it.
Oh, you think because you took hydroxyurea and anagride together, yes?
Yes, yeah, exactly. I think that could have been it. But no one says what it is. No one
Yeah, no,
knows.
nobody will tell you. Don't worry.
No, they won't.
No, that's for sure.
So,
Yeah, yeah, yeah.
so
And now that you take O'Hara, is there any improvement on the on you being tired? Do you see any difference or not yet?
no, I haven't seen any improvement. On the 27th of this month, I go to see my hematologist. Uh, I would see her sooner, but she's on jury duty. So I'll see her on the 27th of November. And then 2 days later, I'll see my cardiologist.
Okay. Well, I mean, you have to give some time also to these new medicines in order that they can react in your body.
I
It's
think you're correct. I think you're
yeah, yeah,
correct.
it's because
But we'll see.
but again, as I said, this being tired, it must be a terrible problem because I know you're a very active person, and if you cannot do anymore what you want, this is very bad.
Well, that's interesting. That the way that you have just posed this idea. Uh, for some reason, I'm learning to live with it.
Sure.
In other words, I used to go to jazz clubs twice a week, 3 times a week. Now, if I go out twice a month, that's a lot at this point because of the tiredness.
Yeah, yeah, yeah.
So, but again, I'm hoping for the best. I've never been in any pain whatsoever, Peter.
That's good. That's good.
Yeah,
Yeah, yeah.
and my the one thing that has not changed is I have a great appetite, and my wife is a good cook, and we eat a largely vegetarian diet.
Good, good,
The only difference between myself and my wife is that twice a week I'll have fish. I love fish,
good, good.
and
Well,
and that's it. And I take nutritional supplements, vitamins,
yeah, 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 yeah,
as well as the medications that I'm on.
yeah, yeah, yeah.
And again, that you brought up a very good point, though. Everything changes. I'm 82 years old now.
Yeah.
Not too many years ago, I was totally interested in sex. I was it was always on my mind.
You're an active man.
Well, yeah, now it's interesting. I no longer have that interest, and it doesn't bother me in any way, shape, form, or manner. And I'm happy that I don't have to think about it anymore.
You see?
So that's interesting.
Yeah,
Uh, so the two things that I still love to do is I don't mind taking naps. I like to sleep,
yeah, yeah, yeah.
but I love to play the trumpet, and I love eating good food. And I also, you're probably familiar with YouTube.
Yes, sure.
And I have, by the way, there is a Jim Coleman channel on YouTube. I have over 1,000 jazz videos on that channel
You do
that
have.
I created over the last 9 years. But I love watching YouTube. I still love going out to jazz clubs and hearing jazz. And although I can't do it as frequently as I did, but I still do it.
Well, don't give
And
up. Don't give up. Don't give up.
no, I won't. And
Don't
I'm
give up.
also very fortunate in that I live in a place that everybody in the world likes to visit. I live on Central Park West on 87th Street, and uh, I have 3 daughters, and all 3 of them have visited me recently. Um, my wife has children, and they've come to visit me. So if I can't go out, they come to me, which is also very nice.
But you have to go out. You even if it's once a week, you have to go out, and
Uh,
you have to be in the world. Don't get
yes.
separated. It's very important. It's
Oh, I agree with you completely.
I mean, I have a luck, but I have physically not yet a big problem. I also have a heart problem. I take the same products as you are taking, but
And Tresto?
yes, yes. but my origin is different. It's caused by a heart problem which I had since 35 or 40 years, and
Oh,
all of it, it's called the electric stimulation to the left side is disrupted, and this is 40 years ago, and but all the cardiologist says, don't worry, no problem, you will not die from that. That's all okay. So during the last 5 years, my cardiologist, he told me every time when I made my check once a year, he said, well, I hear a lot, that your pumping is different. I said, well, that's coming because I have that blockage. He says, yeah, it's coming from that, but I hear it very much. And every year he told me the same. So beginning of this year, when he told me again the same, I said, well, why don't you look at it? Why don't you look what is wrong? And then, he made me a very complicated TC. And when we found out, it was probably worse than he thought, So I have the same as you. I have to take Entresto and all these things. For me, it's curious that I felt better before I took the treatment. Now
I,
it was.
I agree with you.
Yeah, so it's it's changing you too much. It's put the pressure inside of your heart very much down. So
Yes.
I normally had about the beating of your heart. I had normally 70s. Now I'm down to 50. But
That's
yeah,
that's interesting.
yeah, it came down.
How's your blood pressure?
Very low now, 110 or 11 to 6 or 7.
That's because of the Entresto.
Yeah, absolutely. So they bring all the pressure down. So, but for example, in my case, I tell the doctors, it doesn't help me if you treat only the symptoms. You have to find the cause. What has it caused? And we know what it is. So you have to arrange that my electric working, my heart is going well again.
Well, are you familiar with the English term atrial fibrillation?
Yes,
I had atrial fibrillation,
you had that.
and I had a procedure called ablation,
Yes.
and this is where they shot a needle up my groin into my heart, and they zapped the electrical cells that weren't supposed to be there. This happened a few years ago,
Yeah, but
and that helped too.
yeah. Well, you make they have to make the contrary. They have to restore the electrical shock. So it's but listen, it has to be done. That's the only
But Peter,
thing.
one question. You've never had any internal procedure though. They've never done anything except give you pills.
Right. I never had any operation.
There you go. Okay, very good.
Yeah.
All right.
I would like to
Well,
keep it this way, if possible.
and what are you doing with you have PV, correct?
I have PV. Yes. Yes.
And what do you do for that?
Well, I had hydroxyurea during at the beginning I only had phlebotomies and aspirin. And then,
Okay, yes,
when
yes.
the doctors are saying, well, now you're 60, you're a risk patient, etc., you should take a medicine. I said, no, I feel good. Why should I take a medicine if I feel good? So I battled
Yeah.
for about 6 or 7 years. But when my spleen started to grow, so
Ah,
I had to take hydroxyurea, which settled most of it. But beginning of this year, my spleen decided unilaterally to grow again. So it was big already and became bigger. I had a belly which looked like a 5 months pregnant woman,
oh my God.
and a lot of intestinal problems, etc. So with my hematologist, we decided to change medication, and I'm taking Yakavi,
Oh, sure.
the
That's very
originator.
famous.
And I tell you, in 1 week, it brought down my problem of the spleen. So the spleen went down and was perfect. Now I feel absolutely perfect, touch wood. And, looking forward that it keeps another 10 years like this, I
So
hope so.
so you had no side effects with Yakovi.
No, No, I have no side effects from homeopathy. I had in the past itching, which I controlled myself through my mind. And to lose the sex appeal, I had it also, totally, but totally out. And another thing is, I was a I liked whiskey. I loved a very good wine. We have good food in Spain,
Yes,
with a
you do.
fish or with meat. I like to have my glass. Nothing. My body does not want to have it anymore. It's
Well,
not what somebody told me you cannot drink anymore. No, it's my own body who tells me, Peter, no, no wine, no whiskey, no cognac, nothing like this. Very strange. It's very, very curious.
when I was 51 years old, I decided that I had had enough alcohol in my life, and I loved a really good wine. I was an addict almost to Polini Montrachet from Burgundy in France. I
Yeah,
love that wine.
yeah.
And I drank alcohol, rum and coke and everything like that. And I decided just to give it up. My body told me to give it up, and I
Yeah,
gave it up.
it's your body who tells you, yeah. So I'm totally out of these things. But I'm happy. I don't have a problem. I don't have anemia, and I think this is the big thing with this new product.
Peter, you've never had anemia?
No, no.
Oh
Well,
man, that's
I had
that's
low
the big difference.
I had a low iron content, but I was not anemic. Now when you take Yakavi, you have a little bit of anemia, but very little. But I don't get tired, that doesn't exist with me. I don't know what it is.
Interesting. And
So,
oh, by the way, you asked a question before, and I didn't get a chance to answer it. After the hematologist oncologist that was not an expert gave me too much anagrelide and too much hydroxyurea, he then gave me a bone marrow biopsy,
extraction, yeah.
and that's when they determined that from ET it had gone to MF, from essential
Yeah,
thrombocythemia.
yeah.
It
It
went
moved
to
into myelofibrosis,
myelofibrosis.
yeah, yeah. And that's
So that
that's probably also when you started to have to be tired, no?
exactly.
Yeah, because the tiredness is always in correlation with lack of iron and anemia, etc. So and
Yes.
I think we don't have it yet in Europe. I know momelotinib very much because I introduced the product in the hospitals here in Spain.
Oh, as a test.
As a test, in the clinical trials. So I worked with the industry. It was not GSK in these days, it was different. And today, we cooperate a lot with GSK in order for the patients, they know that there is a momelotinib available. And, we don't have it yet, but it will come. And, it's why I'm always very interested to hear, how is it going with the momelotinib, what is your result? And, we will be in touch. I'm sure that your anemia problem will be less and you will be less tired in future. I'm pretty convinced.
I think it takes time. I think you're correct.
Yeah. Well, there's only Yakavi reacts so fast. The others, interferon, you have to wait 3-4 months or something like that it works. And with that here it's also. But
Well,
yeah, go ahead.
as far as interferon goes, uh, I've read all about it, and the side effects for interferon are a little too strong for me, so I wouldn't consider it.
Yeah. Well, somebody
Um,
somebody can't take Yakavi, and then they have to take interferon. There's nothing else available.
uh,
That's the
I see.
problem. Yeah, it's we do not yet have enough products, but there are many in the pipeline, and many new products are coming out. So
I see that. Yes, I noticed that there are different tests being
yeah.
occurring right now.
Yeah. I will be in San Diego beginning of December. There is the ASH, the American Society of Hematology.
Oh,
There's
that's where the meeting will be?
Yeah, it's the annual congress. It's the biggest congress in hematology which we have in the world. About 40,000 people, and I will be one of them.
San Diego has the best weather in the United States.
That's what they told me. So
Oh, it's gorgeous.
I hope to use it a little bit.
Oh yeah.
Although, in Barcelona we can't complain about good weather, so it's.
No.
But I heard also about you have very good food there, and so it's.
Oh, it's wonderful. I love San Diego.
Maybe you come and we meet.
No, I wish, I just don't have the energy.
Yeah, so I have to come to New York.
Yeah, exactly. I look forward to it.
Well, it's my beloved city is New York. When I was young, I wanted to come to New York.
This is an amazing city, Peter.
It is, yeah. It's still the same, yeah. That's good, yeah. Well, okay. Are you still playing trumpet, no?
Sure, every day.
Could you play for 5 minutes?
I can play a little tune for you, of course.
Yeah?
Hold on.
Why don't you?
Okay.
Gee,
Here's my trumpet.
That's a beautiful one.
It's a very nice trumpet. It's called Bach, B-A-C-H, like Bach.
Yeah, Bach.
And it's a very good professional trumpet. It's called the Bach Stradivarius, but it's a trumpet.
Good. It's very old, probably, no?
This trumpet is about 50 years old, exactly.
Jesus Christ.
Something like that.
Bravo. You see, I think it's fantastic, 82 years old, having 2 stents, having heart problems, having minor fibrosis, being anemic, and playing trumpet. This is beautiful. I think, this is so important.
Day.
This is so important that people keeps on doing his life, and people keeps on
today at 3 o'clock New York time, I have a student coming for a trumpet lesson.
Oh yeah, good.
Yeah, I have one student that I'm working on, a 15-year-old kid who is very, very serious. If they're not serious, I don't want anything to do with them.
Sure.
But he practices all the time, and he loves the trumpet, and he's in 3 different orchestras in his school. So, and it makes me good that I can connect with younger people.
Yeah. Very important to do the right thing. This is very good, It's the same. I keep on with my patient organizations and everything, very busy with that. And so I'm fully busy all day. So I think this is the most important.
Well, Peter, we're both fortunate in that it seems that our mental acuity is good.
Yeah, absolutely.
That I don't have a problem with my mind yet.
We'll keep it this way. We will keep it this way.
Yes.
Absolutely. Okay, Jim, thank you very much. It was a really great pleasure. It will not be the last time that we talk to each other. So, Jim,
absolutely, Peter.
Take care, and I hope that this medicine will do its work, and you can enjoy more.
I'll certainly let you know.
Please do. Yeah? Okay. I wish you a beautiful day, yeah?
Same here.
Keep strong. Bye-bye. Bye.
Ciao, ciao.
Bye-bye.